Good afternoon and welcome to the Alliance for Home Health Quality and Innovation webinar on the 2021 Home Health Chartbook with Avalere and the National Association for Home Care and Hospice. My name is Jennifer Schiller and I'm the Executive Director of the Alliance. By way of background on the Alliance is a 501c3 research foundation. The Alliance's mission is to lead and support research and education on the value home health care can offer patients in the evolving U.S. healthcare system. Working with researchers, key experts, thought leaders, and providers across the spectrum of care, we strive to offer solutions that improve home health care at home through quality and innovation. Today's webinar will serve as an overview for this year's Chartbook, how to use it, key data from this year's edition, and more. The AHHQI Home Health Chartbook is an annual compilation of data and statistics compiled by Avalere and commissioned by the Alliance, which offers a glimpse of home health patients, the home health workforce, organizational trends, and the economic contribution of home health agencies. I would like to first thank our co-sponsor of the 2021 Chartbook, the National Association for Home Care and Hospice. We're excited to have NAC President William Dombey on today's webinar to say a few words.
Well, thank you, Jennifer, and thanks everybody for joining us today. You know, I'm really here to try to express the great value that comes with this Chartbook, as well as the great value about the Alliance itself, and really strongly suggest you take a look at the Alliance website and see all the tremendous work that has been doing over the years to help advance healthcare services at home, particularly home health services. As a member of the board of directors for the Alliance, you know, I get to see the inner workings of it, and it really is focused on what will advance the home care into the future. But as for the Chartbook, it has tremendous value itself, and we're so honored to have the opportunity to have sponsored it. When I look at the value that I see a very, very wide range of it, from being able to use as a benchmark for looking at your own operation, for dealing with the media, local media, state media, even national media. Great, very reliable statistics within it, but also for having conversations with other healthcare providers across the spectrum of healthcare to get them to have a better understanding of where is home health within that whole care spectrum. We'll be using it certainly on our end for advocacy on your behalf with Congress and with regulators. And I think when you see it too, you'll notice there's even some very special elements there that should help on recruitment and retention and staff to show, you know, we're not your great grandmother's home health care services. It's so far advanced in terms of what it is. And then even on the aspect of diversity, equity, and inclusion. You know, home health care, we know, is a special service, but is also a service provided widely to people of all ages, races, and levels of disability. So Jennifer, thanks once again for the opportunity to be part of this great Chartbook, and I look forward to this journey through the tremendous data. So thanks again for making me part of this.
Thank you so much, Bill, and the rest of the NAC team who's been so integral in helping the Alliance and also in getting this Chartbook and this Chartbook webinar ready for everyone. So with that, I'd like to welcome today's speaker, Melissa Morley of Avalere. Melissa is a health economist and principal in Avalere's policy analytics practice. Her work focuses on healthcare financing and payment and analysis of Medicare and commercial claims data to understand the impacts of policy change. Her areas of policy expertise include post-acute care payment, episode-based payments, and risk adjustment. Prior to joining Avalere, Melissa worked at RTI International for over a decade, where she led projects for Assistant Secretary for Planning and Evaluation, the Centers for Medicare and Medicaid Services, designing, implementing, and evaluating alternative payment models with a specific focus in post-acute care payment policy. She has a PhD from the Heller School of Social Policy at Brandeis University and an MA in Economics from McMaster University and a BA in Economics from Tufts University. Really quickly, a few housekeeping notes before we get started. Melissa will speak for about 40 minutes and we will leave the remainder of time open for questions. You may see that you're all muted. You can submit questions through the question box in the control panel at any time during the webinar, and I will ask them to Melissa at the end of the presentation. Within a week of the webinar, slides and a replay will be posted to the Chartbook section of the Alliance's website for anyone who may miss it or anyone who may want to share with their colleagues. So with that, I'd like to turn it over to you, Melissa.
Great, thanks very much, Jennifer. Good afternoon, everybody. It's a pleasure to be here today to present the work that we've been doing with the Home Health Chartbook for 2021. As Jennifer introduced, the purpose of this work was really to take a deep dive into the characteristics of Medicare home health users. So in this chartbook, you'll find a lot of data that characterizes the characteristics of beneficiaries in terms of demographics, their clinical profile, and some utilization characteristics, including number of visits and episodes. We'll also have a section that we'll briefly go through that talks about how home health fits into the broader healthcare industry and point out some workforce trends. There are a lot of additional details beyond what we'll be sharing today that are available on the AHHQI website. We'll just be going through a sampling of the data from the chartbook, but additional detail is available. And specifically, I want to highlight that that detail is often available at the state level, which can be useful as you try to learn more about your specific levels of geography. I also want to point out that there are previous chartbooks are also posted on the website, and we have sort of intentionally laid out this chartbook to be consistent over time so that similar analyses can be easily identified. So while we do present some trend data in the current chartbook, if you're interested in more detail over time, that is also available on the website. So the key data sources that we've used in this work, and I'll point this out as we get to each section, I guess we have three primary data sources. First was the Medicare Current Beneficiary Survey, the MCBS. The second was the Medicare claims data, and third is public use data to inform some of the workforce trends from the Bureau of Labor Statistics. In conducting these analyses, we used the most recent available data sources at the time of the analyses. So for the MCBS, that was 2018, but for the Medicare claims data analysis, that is 2020. So this is the first time that the chartbook will reflect some of the utilization patterns as a result of the COVID-19 pandemic. Great, we can maybe move to the next slide. Great. So as we orient to this content, I'll just point out that there are 6 sections of data that we'll walk through. First is on demographics. Second is the clinical profile, specifically comorbidities, impairments with activities of daily living. Third is an overview from the post-acute care market perspective. Sections 4 and 5 talk about organizational trends in home health and that economic contribution of home health to the labor market. And last is outcomes. And in the data that we present today, we'll specifically point out outcomes related to readmissions. And within the chartbook posted on the website, there's more information in the appendix on that methodology for calculating the readmissions. Great. So next we'll dive into some of the data that we calculated in the demographics section. So all of the data that we present in this section comes from the Medicare Current Beneficiary Survey. So this is 2018, still pre-pandemic, but following the trends of the previous years, we use this data source, and we'll walk through some of the characteristics related to age, gender, income, and comorbidities. You'll see through this section that we generally highlight the characteristics of the home health user relative to the characteristics of the Medicare beneficiary population overall. So this first slide just looks at the overall age distribution of home health users compared to the overall Medicare population. And no surprise, just confirming what we've seen in the past as well. As we know, there's a significant portion of Medicare home health users that are over the age of 85. 25.5% of beneficiaries using home health are over 85 compared to 10% of the overall Medicare population. But as identified during the introduction, Medicare home health users are of all ages. So 11.8% of that Medicare home health user population is under the age of 65, compared to 14.9% for Medicare beneficiaries overall. But on average, the Medicare home health population definitely skews to the older age groups. In this next slide, we took a look at home health use among Medicare fee-for-service beneficiaries versus home health use among Medicare Advantage beneficiaries. And this was an important topic to explore given the growth of Medicare Advantage over the last 10 to 15 years and the known differences in use patterns across these populations. So what we see here is that 7.4% of Medicare fee-for-service beneficiaries use home health services. Among the Medicare Advantage beneficiaries, 6.7% of beneficiaries use home health services. So a slightly smaller proportion of beneficiaries in Medicare Advantage are using home health relative to fee-for-service. And just relative to what we saw last year, I just wanted to also point out that this is a slight decrease among the Medicare Advantage beneficiaries. In the analysis of the previous years of data, we saw that the proportion of home health users was more similar across these populations. So this is something that we'll want to sort of keep an eye on for trends going forward. Next, here we show the percent of beneficiaries with different numbers of chronic conditions. So on the left, we have our home health users, and on the right, we have all Medicare beneficiaries. We've broken this out to look at the proportion of beneficiaries with 0 to 2, 3, 4, or 5 or more chronic conditions. And what we see is that there is a significant proportion of the Medicare home health user population with 5 or more chronic conditions. We see 43.3% of beneficiaries in that category, compared to 21.6% among all Medicare beneficiaries. At the other end of the spectrum, there's a much smaller proportion of Medicare home health users with only 0 to 2 chronic conditions, at 17.7%. Whereas among all Medicare beneficiaries, there are 40.5% of beneficiaries in that 0 to 2 chronic conditions category. So just overall, this just provides more information on the level of comorbidity among the home health user population. Great. In this slide, we take a slightly more detailed look at health status and comorbidity across by race and ethnicity. So here we've looked specifically at Black Medicare home health users, Hispanic Medicare home health users, and all Medicare home health users. So overall, there's a similar proportion of beneficiaries across these 3 groups having 3 or more chronic conditions, between 78.5% and 83%. However, when we look at these other metrics, having 2 or more ADL limitations and self-report of fair or poor health, we see that there is a higher proportion of beneficiaries, Hispanic Medicare home health users, that have 2 or more ADL limitations, or who report fair or poor health relative to Black beneficiaries and all Medicare home health users overall. So this is just some more detailed information suggesting differential needs across the Medicare home health user population. Another characteristic that we wanted to explore was severe mental illness. So this was on the left, we've explored it among the Medicare home health users, on the right among all Medicare beneficiaries. And severe mental illness is defined as having depression or another mental disorder, including bipolar disorder, schizophrenia, or other psychoses. And we see that 37.1% of home health users are identified as having severe mental illness, compared to 29.3% of Medicare beneficiaries overall. And we'll see this on subsequent slides, but there has been an increasing trend in the proportion of Medicare home health users with severe mental illness. So this is something that definitely we're keeping an eye on, as it does look to be a growing focus area among patients receiving home health. So this slide is just sort of a summary table of some of the topics that we were looking at in the previous slides, but there's a few additional details that I'd also like to point out here. So on the left, we have some of these characteristics of age, chronic conditions, ADLs, living situation, etc. We compare this for all Medicare home health users versus all Medicare beneficiaries, similar to the previous slide. But just some of the new information to point out is that in looking at the percent of beneficiaries with income at or under 200% of the federal poverty level, we see that 57.8% of Medicare home health users fall into that category, compared to 42.7% of all Medicare beneficiaries. So there's just a higher proportion of Medicare home health users identified as low income. I'd also like to point out the live alone category. We see that there are a higher proportion of Medicare home health users that live alone, 37.2%, compared to 29% of Medicare beneficiaries overall. So living status is not equal to caregiver status, but it is, I think, something that's important to keep an eye on and track, as that certainly affects both need and level of home health care services. This is an example of how we've pulled some of the data from the chart books over time to look at some of these trends. So we've looked here at from 2012 through 2018 at the proportion of Medicare home health users with these different characteristics. So with 3 or more chronic conditions, we see that in general that has remained somewhat stable between about 81% and 86%. That's sort of the range we see here, but not significant movement. We did see some more movement in the proportion of beneficiaries with 2 or more ADL limitations. That has changed a bit over time. It was 34.2% in 2012, and that has decreased to close to 28% more recently. Similarly, I'd like to point out that the proportion of beneficiaries with incomes under 200% of the FPL is also decreasing over time. So while that proportion is still greater than what we see in the Medicare population overall, we have seen that proportion decreasing over time. Couple of other notes, I guess, related to the point on SMI in this last row is that this increasing trend in the proportion of beneficiaries identified as having SMI. You can see that really clearly here, with 27% in 2012, 2013, but increasing significantly to 37% in the most recent year of data analysis. Great. In this next section, we're going to take a look into our claims data analysis. So I just want to start us off with the framing that this is the 2020 claims. This is the first look that the chart book has had into post-pandemic home health utilization. But I'm going to walk through a single table that came from this section, but I also want to note that there is significantly more detail available on the website. A lot of this information is available by state, but on this next slide, we'll just present some of the overall takeaways nationwide. Great. So here we've looked specifically at hospital-initiated home health episodes, and we've identified the most common hospitalization MSDRGs for those prior acute hospitalizations, and looked at how that's playing out in terms of who is going to home health. A couple of things to point out is that there is, first of all, significant concentration. These top 20 MSDRGs account for 38.26% of all of the discharges to home health. So there's just significant concentration in the types of of patients that are receiving home health in terms of what they had their prior acute hospitalization for. So these top three were septicemia, heart failure, major hip and knee. These have remained fairly constant across our years of data analysis. These three MSDRGs alone account for about 15% of all of the home health use for hospital-initiated home health episodes. However, a couple of things to point out specifically related to how does this differ compared to 2019. So for the major hip and knee, we see that 2.95%. Last year, in the 2019 data analysis, that was 5.17%. So there was a significant decrease in the proportion of beneficiaries receiving care in home health after a major hip and knee replacement. This is clearly expected given the changes in use patterns and the avoidance of elective procedures when possible, but it just is important to note how this exactly plays out in the data. Another important change relative to 2019 is this that the number 4 MSDRG is respiratory infections and inflammations with MCC at 2.87%. So that's a very high ranking, and this was not this did not emerge among the top MSDRGs in the 2019 analysis. Again, I think a reflection of the changes in use patterns and clinical characteristics of patients receiving care during 2020. One other note that I want to make as you review the chart book and sort of compare some of the content relative to earlier years, I just want to point out that the number of claims that we see in this slide reflects the movement to PDGM. So either in the movement from a 60-day to a 30-day home health episode. So this is counts of 30-day home health episodes. So they can't be directly compared to that same column of data in the previous years where there were 60-day home health episodes. So I just want to, as you consume the data yourselves, just to keep that in mind, that that's just an important difference due to the change in the payment systems. Great. Section 3, we just have a few points that we want to make related to the post-acute care market in general, and point out how home health care fits in relative to other post-acute care service use. So in this slide, we've looked at the proportion of beneficiaries that are discharged from an acute hospital stay and where do they go. And we see that about 57% of beneficiaries are discharged from an acute hospitalization to the community. About 34% go on to post-acute care services. And on the right, we've broken down that 34% into where exactly do they go, which post-acute care settings. And the dominant settings are home health, skilled nursing facilities, and in the green, and sorry that the values don't appear to be showing on the slide right now, but we'll, that is on the website and we'll be sure to update it for that presentation. But the green is the skilled nursing facility, the blue is home health, the lighter green is inpatient rehab, and that darker blue is long-term care hospital. So this actually just breaks down the numbers that we were that were intended to show in that previous slide. We see those actually on that far right column for 2020. So you can see it's about 16% of beneficiaries who are discharged from an acute care hospital go to skilled nursing facility. About 13% go to home health. Here, we've also wanted to look at trends over time from 2015 to 2020. I think a first takeaway that folks are going to see is that the height of the bar for 2020 is lower relative to the other years. Again, this is likely was due to COVID impact and to the very significant decrease in healthcare utilization overall. But for those that did use services, there was less change in the types of services they used, proportionally speaking. One exception to that might be for skilled nursing facilities. So you can see that there has been about 19 to 20% of beneficiaries discharged from acute hospital to skilled nursing facility. That did decrease in 2020 to about 16%, again, likely due to the challenges of the COVID-19 pandemic and the in terms of use overall and changes in setting choice following discharge. Great. One other, I think it looks like the numbers, oh, we got the numbers, but the values aren't showing again, apologies. But what we have seen in this slide is what we wanted to do is come back and not only look at those hospital-initiated episodes, we wanted to look more broadly to see where are beneficiaries coming from, regardless of whether or not they're a community-initiated or hospital-initiated home health user. So we see that the over half of beneficiaries are coming from the community, and about 8% are coming from a skilled nursing facility. Again, I just wanted to point out a trend relative to 2019 is that while 8.6% of beneficiaries are entering home health from a SNF in 2020, 11.2% entered home health from a SNF in 2019. So again, it's that change in the pandemic impact definitely has exhibited greater effects in the skilled nursing facility, and that is playing out into where home health agencies are receiving patients from.
Hi, Melissa. I just want to cut in. We're having some issues with the PowerPoint presentation. So what I'm going to do is I'm going to pull up the slides that we're having an issue with in PDF so that we try and hopefully don't have any issues with them moving forward. So if you give me 1 second, I will get back to that, and I can make sure that we're only getting to the slides that we're going to cover today.
Okay, that sounds great.
A technical issue that we are having to everybody, and we will be back up and running shortly because I can see that we're having some issues with a number of our slides today. And Melissa, if you don't, if you wanted to, I believe the next slide actually comes from section 4 and section 5, so we can go ahead and start that while we get the slides up for everybody.
Okay, that sounds great. I have the version with the numbers up as well. Okay, in this next section, section 4 and 5, we look at service use trends, organizational trends, and service visits per episode. And we also look at employment and labor statistics. So while we'll present some of this overall in the next several slides, if you look back on the website, you'll find this detail available at the state level. Great. So here we've just plotted out from 2007 to 2020 the number of Medicare Part A and Part B home health episodes. So Part A and Part B meant to differentiate between hospital-initiated versus community-initiated home health episodes. First to note, again, as I mentioned earlier, because of the change in the payment system in 2020, the number of episodes for 2020 is not directly comparable to the previous years of data, but we're starting a new trend for going forward here. But the takeaway I'd like to point out is that there was just an increase in total episodes overall between 2007 and 2011, and a slight decrease after that. There also has been, I think, when you look at the height of the dark blue versus the light blue bars, you can see that there over time a decrease in the height of that dark blue bar. The hospital-initiated episodes as a proportion of total episodes does look to be decreasing, and some of this has to do with just overall trends in hospitalization rates over time, just decreasing slightly as well. But in addition to, while 2020 is hard to interpret in relation to home health episodes, we flip to the next chart, we look at beneficiaries. And obviously, looking at the number of beneficiaries over time, we can compare more easily across all years of our data. So here you can see the decrease in the total number of beneficiaries receiving home health in 2020, again, due to those massive changes in home health in healthcare utilization generally. But you can see also, we're on the previous slide, we saw increases in number of episodes between 2007 and 2011. That was also reflected in an increase in total beneficiaries between that same period. Whereas in the previous slide, we saw a slight decrease in the number of episodes after 2011 to 2019. We see fairly stable home health users during that period, with the exception of 2020. So this, the change in home health utilization more recently has been with respect to, with the exception of 2020, similar number of users, but decrease in number of episodes. And then here we take again, we wanted to learn more about these episodes per home health user, and we explicitly look at 2020 and do not compare to the other years of data due to the change in the definition of an episode in 2020. But overall, the average number of episodes per Medicare home health user is 3.04, but this does differ by hospital-initiated versus community-initiated episodes. The community-initiated beneficiaries on average have more episodes at 3.15 compared to those who initiate from a hospital, who have on average 2.29 episodes per person. Actually, if we could just go back to the slide right after the visit slide, just a bit more back. Yes, that's it. So while hospital-initiated home health users have fewer episodes relative to community-initiated home health users, they do have more visits. So we did want to explore that here. We see that hospital-initiated episodes have about 9.4 visits on average, compared to 8, just over 8 among the community-initiated episodes. Great, and then in this last slide for this section, we've plotted the number of home health jobs nationally over the period 2004 through 2020. And there's just been significant growth over this time period. This is all reported in thousands, but you can see 771,000 in 2004 to 1.5 million in 2019. Again, important to note in terms of understanding trends and pandemic impact, as we see this decrease for the first time in the total number of jobs in 2020. Again, this was just 2020. We'll have 2021 obviously next year, but there was an impact on total jobs, though slight, in 2020. And just one other note on that, trends data for the Bureau of Labor Statistics and total jobs, that is also available at the state level in the broader chart book. Great, and this last section, we take a look at home health outcomes. And within the chart book, we look at a variety of outcomes, including quality measures that are reported on Home Health Compare. We do some comparison of measures across settings. We look in detail by state, but today we're just going to pull out some of the readmission measure statistics as just an illustrative example of the types of information that you can explore further within the chart book. So on readmissions, here we show among beneficiaries who are discharged from a hospital and are discharged to home health and are discharged to SNF, among the most common MSDRGs, we've looked at the readmission rates in these two settings. Very important to note in interpreting this data is that these are not risk adjusted to take into account the differences in the beneficiary comorbidity status or other diagnoses or impairments, or these are just straight calculations stratified by the prior diagnosis and the hospitalization. So this is just to provide landscape information of the types of patients who are discharged from a hospital to these settings and what those readmission rates are. But what we see on average is that across all MSDRGs, the readmission rates from home health are slightly lower relative to the readmission rates for those discharged to SNF. So we see 17.3% among beneficiaries discharged from hospital to home health, 17.97% among beneficiaries discharged to SNF. And this was actually fairly consistent with what we found in 2019 as well. However, when you look at the diagnosis level, there are some differences. In some cases, home health has higher readmission rates. In some cases, SNF has higher readmission rates. It's just on average, it is coming out to be very, very close. Just to point out a few, for like heart failure and shock, for example, the readmission rate from home health was 22.58% versus 23.78% for those discharged to SNF. I know that there's been a lot of focus in some of the orthopedic conditions, and we'll take a closer look at that on the next two slides as well. But when you look further down this list at hip and femur procedures with MCC and with CC and major hip and knee joint replacement, those at the bottom of the list, you see on average that the readmission rates for those that are discharged to home health are lower than the readmission rates for those that are discharged to SNF. So again, this is just meant to be, provide some contextual information stratified by MSDRG, but there's no further risk adjustment in this particular methodology. And in the last couple of slides, we just take a slightly, we double click in a little bit to see readmission rates for two specific MSDRGs for 469 and 470 to learn more about across more than just skilled nursing and home health. Here we also bring in inpatient rehab. Here we could plot the trends in the readmission rates over time. So for 469, which is the MSDRG with the for major joint with major complication or comorbidity, you see that there has been, for those that are discharged to home health it has been fairly constant over the period 2010 to 2019, though there was a slight increase among beneficiaries discharged to home health with a readmission in 2020, 10.4% compared to 9.6% in 2019. But that slight increase occurred across the other two settings that we explored as well. There was an increase in inpatient rehab and a slight increase in the patients discharged to skilled nursing facility. And what I think that this may be reflecting is that the patients that were discharged from an acute hospital in this MSDRG in 2020 during COVID, like they were different than the patients in 2019. They're likely having more comorbidities that may result in greater need for readmission. There was just a lot of different things happening in 2020 that may be behind this slight increase in readmission rates that we observe across all three settings that are explored here. In the next slide, we also show it for the sibling MSDRG of major joint replacement without major complication or comorbidity. So while the readmission rates are much lower for this less complicated population, we still see that same trend of increase in readmission in 2020. So though this particular MSDRG was, I think the use behind it was just very different in 2020, but we did want to keep sharing with you the trends that we are observing, since this has been an area of interest and focus over the years. Great. I guess with that, I'll close and turn to Jennifer to see if there are questions from the group.
Thank you so much, Melissa. I see a couple questions, and I want to encourage people that if you continue to have questions, please feel free to type them into the chat box. And if we don't get to your question, or if we can't answer your question right now and we need to dig a little bit deeper into the data, my email address is jschiller@ahhqi.org, so please feel free to reach out to me separately. I do see a couple questions, so I will start with the first one, which is, has there been any pronounced change in the admission diagnoses in home health care since PDGM has been introduced? And good, go ahead.
Oh, I guess I don't have that right now, but I can dig back into that and answer that more clearly. I think that we were generally characterizing it based on the prior acute stay, and where we, back to that slide where, top 3 MSDRGs that are discharged to home health, didn't change significantly in 2020 versus 2019. Well, that's from the MSDRG perspective. To the question, I think that it would be important to look at that from the diagnosis on the home health claim perspective as well. We can certainly follow up with that.
Thanks, Melissa. We also had a question that asked, is the impact of COVID a consideration for the 2020 data?
Definitely. And so COVID, we did not exclude anything. We wanted to report, what happened, but I think that the impacts that we're seeing are in the decrease in the number of beneficiaries using home health. We're seeing and then the change in the types of beneficiaries. So while the top 3 MSDRGs discharge to home health didn't change significantly, we did see that there was a change in the proportion of beneficiaries in those top 3. And we also saw that the treatment for respiratory infections in home health increased significantly in 2020. So I think those are just a few of the COVID impacts that we are seeing. And I guess one point I'd just like to raise as well is that while we looked at those characteristics of the population, at the start of the presentation using the Medicare Current Beneficiary Survey 2018 data and looked at the proportion of comorbidity, like how many proportion of people with 5 or more comorbidities, for example. That was in 2018, and that's not aligned with 2020. So what I'm really curious to see in the future is when we get, is to map those comorbidities to the data, because I hypothesize that the characteristics of the patients, they were more acute in 2020, and it would be nice to be able to demonstrate that in the data.
Thanks, Melissa. And I think 2 points. One, I think answering any of these questions is both really difficult because you have 2020 with the convergence of got a question on PDGM and a question on COVID, and except for about a 6-week to 2-month period, they basically were in step and happening at the same time. So it'll make the 2022-2023 chart books that much more interesting to go through and see, if there's any divergence from these stats as we see maybe PDGM continue to take effect, and maybe COVID having changed long term, or maybe it was a more short term change for some of these patients who were admitted to home health, be it diagnoses or be it clinical profiles. And it'll also be interesting to see whether the clinical profiles, you had more acute patients, but you also had more patients that were seeking care that were outside of a hospital or an institutional setting. So that data is unfortunately a few years delayed, but it'll be interesting to look at moving forward. So, one question I have for you is, are there some big trends in home health that you noticed in the current chart book?
Sure. I guess a couple of things that really caught my eye that I'll just reiterate as important things to maybe keep an eye on going forward was this slight dip in the proportion of beneficiaries in Medicare Advantage using home health in 2020. I'd be very interested to keep tracking that, as that was not a trend that was observed previously. And then that increase in the proportion of beneficiaries with severe mental illness, I think that is it's a challenge, and will require some different types of care, and it poses some challenges for training and caregiver support as well. So I think that following that will be important. And then to the point raised earlier, just who's entering home health, there's just been the decrease in the elective procedures during the COVID pandemic. What will, as that trend reverses, how is that going to affect the patient flow and the overall population receiving home health? So I think that just looking at the characteristics of the patients through the pandemic is important to note. But I guess those were just a few trends that I definitely noticed in reviewing all of this data.
So I have another question that asks, are there any clinician productivity measures in the chart book?
So specific to productivity, I think no. That is mostly focused on broader market characteristics. Though there is we have information on jobs and we have information on visits, but those can't explicitly be linked to a productivity measure. But it can provide some information about total visits provided in a geographic area, total home health jobs, that can give some sort of broad stroke geographic understanding of productivity as defined by jobs in jobs versus visits, but that's not FTEs, would just be another note that I would make on that.
We do also have some quality of patient care and star ratings metrics in section 6, which aren't, again, specifically clinician productivity measures, but we have things like checked patients for depression, checked patients for risk of falling, diabetic patients got doctor's orders, et cetera. And those are also broken down by state as well. So we have both the national numbers for that and we have the state numbers for those as well. And another question that I have for you, Melissa, is, I guess, is there anything that surprised you in going through and compiling the chart book?
I think nothing was, I think it was more, can we confirm what we suspect was happening during the pandemic? And I think, that was important to do. We did see that the decrease in total volume. We saw the shift in the types of patients. So that was not surprising, but I think good to confirm. I guess the decrease in the number of home health jobs, also not surprising given the change in the demand for services. But I think it's something that will be important to keep an eye on, particularly as the demand for services in the home increases. And that's just good. There may be labor force challenges and constraints outside of healthcare as well that I think a lot of industries are facing. But with the potential increase in demand for services in the home, making sure that the labor force can accommodate that, I think is going to be important to keep track of.
And this was one of the slides that we had. I think this slide we had an okay time with, but it was around the slides that we had trouble with. So I apologize again for that. But one thing that also jumped out to me is that, the change in post-acute market share and patient destinations following an inpatient stay. So that's chart 3.3 for anybody looking at the chart book. Obviously we know that total number of Medicare beneficiaries receiving discharges from hospital went significantly down, by many, 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 many thousands. But that, pretty much home health kept the same market share as it's had for year over year. So I'll be interested to see, if that's a trend that continues or a trend that stays. And then, as you said, one thing that really jumped out to me was certainly the number of major joint replacement. It used to be the top MSDRG for home health. It was replaced by septicemia a few years ago, but the fact that it dropped all the way down to third, and that it had such not just a decrease in total percentage, but that it had such a decrease in total number of claims too. Whereas heart failure and septicemia actually saw more claims in 2020 over 2019, that saw significantly less. It might not be super surprising, but it's certainly something I think that's of note. And then, while I wait for other questions, is there something we should keep an eye on for the 2021 data?
Yeah, what I guess I'll be keeping definitely an eye on is finding ways to continue to align our understanding of those patient characteristics with respect to the changes in the claims data. So I definitely want to know more about that, the comorbidity profile and how that maps to the changes in utilization by different types of diagnoses. Other things that I definitely think that we should keep an eye on is the change in with the living situation. As I mentioned earlier, I know living situation is not necessarily equal to caregiver status, but keeping an eye on this with that lens of potential growth and demand for services at home, as we've seen during the pandemic and expect to continue going forward. Understanding living situation and caregiver status, I think will become important to support access. And also understanding the relationship between with SNF as well. I mean, we saw that there was a significant impact in terms of the proportion of beneficiaries entering home health from SNF during the COVID-19 pandemic. There was a, so that's just, there was a, like this happened due to the pandemic, but will it persist? I think that that's another thing that I think we'll definitely keep an eye on in the subsequent years of analysis.
So we have a few more questions. One, we might have to come back and look at, and the first question is, was there any difference made in visits per episode in non-Medicare populations?
That's a great question. But this particular analysis focused on the Medicare population only. So unfortunately, I can't comment on the effects in the non-Medicare population.
And then the second question we have is, considering larger trends that you watch as somebody who works not just in home health, what should we be aware of outside of the home health and healthcare spaces? I think specifically outside of the home health and in other healthcare spaces.
That's a great question. I guess, yeah, like just continued, like what, I guess what can be done at home is changing. So that's something that I look at for, I guess, across the spectrum of care of, you know, of things that can be done at home versus things that can be provided under the home health, like Medicare benefit, is something that's sort of interest. And, you know, as care at home evolves, you know, potentially the Medicare benefit may evolve as well. And so I guess that's a lens that I look at these issues with. Like, you know, this isn't just about one service type, it's like, or one payment system. It's about what can be done at home, and you know, thinking about how the payment systems can change to reflect the range of things that can happen at home.
Thank you, Melissa. I really appreciate it. And, you know, I think one of the things that we will continue to look at, you know, moving forward is related to both of these last two questions. And that is looking at both the Medicare and the non-Medicare, and very specifically, I think we'd love to be able to get more Medicare Advantage challenge, as I know Melissa knows, but we'd love to be able to build out some of that, and we can try and look for some of the data on non-payer sources, at least like a very, very high level overview. And then, you know, as the Alliance, as all home health and I think healthcare organizations at large are doing, is looking at what our role is in the space and continuing to watch trends and watch what's happening in other areas of healthcare and other areas of care at home. So we're always trying to figure out what exactly we need to know to stay on top of everything and move forward. So with that, I really want to thank everybody for their time and for attending today's webinar. And I apologize again for our technical issues, but for bearing with us throughout. We really appreciate your support of the Alliance, and we really appreciate your interest in the Home Health Chartbook. As a reminder, a replay of the webinar will be made available within the week on the Alliance's website. We'll try to get something out to you too with the recording and with the full Chartbook, which can be found on our website at ahhqi.org. If you have any questions about the Alliance, about membership, about our 2022 research funding cycle, please don't hesitate to reach out to me via email, as I said, at jschiller@ahhqi.org. And a final thank you again to the National Association for Home Care and Hospice and Bill Downby for all their support for the Alliance and the Chartbook. So with that, have a wonderful, and Melissa as well, for being able to present and all the work that Avalere did on the Chartbook this year and over the years. So with that, have a wonderful holiday and please stay healthy and safe, everyone. Thank you.